Welcome to Medicare. This presentation, just so you know, I am not a Medicare insurance salesperson of any type. This is to give you a background on the Medicare system, thinking about the context of Medicare in your total financial picture. We're going to go over today some costs associated with Medicare, what the basics of Medicare are. And then, Vanya, do you have the date where you're going to do the Medicare specific to UCSD, where they go over the individual plans within UCSD? What's the date on that?
Yes, so that's this Wednesday, the 29th from 10 to 11:30.
Fantastic. So if you want more specifics on your UCSD specific plan, you'll get that and they'll be able to answer questions about, the high plan, the Kaiser plan, all these different plans, and exactly when you should be signing up. The goal of this presentation is simply to give you a background overview of Medicare and get you thinking about certain costs and things that you may or may not be thinking about when it comes to Medicare. So that being said, I'm going to go ahead and take the screen here, Vanya, and I'm going to bring up the presentation and we'll get started. Again, as I say all the time in these UCSD presentations, please raise your hand or feel free to jump in, unmute yourself if you have a question, because these questions are for you, not for me to just run through a bunch of slides. That being said, and I would also encourage you, if you have never been to one of our investment interest groups, fourth Tuesday of every month, tomorrow we'll be going over the collapse of Silicon Valley Bank and what led to it. And we'll be going over some of the different facets associated with the intermediate banks and risks that potentially are out there for you and risks that are not out there. So if you're interested in that, tomorrow it starts about 11:59 and we'll be done tomorrow a little bit early, Vanya, because I have my daughter's review at her school at 1 o'clock, so we'll be done about 45. So look forward to those of you that will be on that tomorrow. That being said, let's go ahead and get started here with Medicare. Medicare, what baby boomers need to know about Medicare and long-term care. So 3 key points. If you do not enroll in Medicare on time, you're going to pay a monthly penalty. There's a monthly penalty in both Part B and D premium, and I'll go over exactly what those are. But you do not want to miss your enrollment time in Medicare. If you not get the right private insurance to go with your Medicare, you may pay too much and premiums or out-of-pocket costs. And by the way, I see Chris and Alec and Gail there. Can you give me a thumbs up if you're seeing my slides? Okay, perfect. Great. Just want to make sure. Thank you. Key point number 3, if you do not plan for higher healthcare costs in retirement, you could run out of money or not be able to get the care you need. And I'll go over some of the little intricacies associated with Medigap plans versus Medicare Advantage plans and how they differ from a standpoint of qualifying for them or being restricted because of health concerns. All right, so let's talk about part 1 here. We're going to talk about Medicare enrollment. What is Medicare? Who needs to enroll Medicare and when? And how do you enroll Medicare? And this, again, is not tailored specifically to the UCSD crowd. This is kind of a general on Medicare. And the reason I do this is many of you are married to folks that are not in the UCSD program, or maybe your partner is not in the UCSD program. And so, yes, they could be on your healthcare, but maybe they have some other specifics with their job, or maybe they're a business owner. And so I'm going to go over some of those facets too, and things they should be thinking about. So it's kind of an all-encompassing Medicare presentation, if you will. In part 2, we'll talk about the Medicare and private insurance partnership. Right, Medicare is just simply a partnership between the government, right, in parts A and B, and Part C or D, or your Medigap policy is the private market, right? So it's a public-private partnership. How much does it cost? What does it cover? What does it not cover? And specifically, how do private insurance companies work with Medicare? How does that public-private partnership? Part 3, we'll just talk about higher healthcare costs. Talk about 2 reasons your healthcare expenses will be higher, right? Inflation, obviously. Increased need for services as you age. We'll go over some numbers there. And just remember that Medicare does not cover long-term care expenses. I'll briefly touch on long-term care. I know you have somebody that comes in and does a specific presentation on that, so I don't want to steal their thunder, but I will go over some specifics you may want to consider. All right, so that being said, let's get started here on part 1, Medicare enrollment. So who pays for healthcare in the United States? So just a little quick review. Medicare was established in 1965, right? It's part of Lyndon Johnson's program. And you pay for Medicare through what's called your OASDI, which is Social Security wage taxes. And on the end of that, you have what's called HI, which is your health insurance, right? And that pays for your Part A Medicare and qualifies you for not free Medicare, but your Part A, so you don't have to pay a premium. So before age 65, most people in the United States have an employer group health insurance plan. or they're on a retiree health insurance prior to age 65, COBRA, which just stands for Consolidated Omnibus Reconciliation Act, I think of 1984, 85, something like that. The COBRA is just if you leave an employer, right, before your Medicare, you may be eligible for a 12 or 24-month COBRA to give you the same type of insurance that you had at your prior work at a higher cost, instead of not helping subsidize that. And then you have individual health insurance. Obviously, this is exchanges and Obamacare. And then other down here would be, for example, I'm a retiree from the United States Navy, and so I'm eligible for TRICARE. So that would fall under the other category. And TRICARE, even though it's sponsored by the government and for government employees, particularly military that retire, it's still a public-private partnership as well. So after age 65, Medicare generally pays first, okay? And then your other insurance company or your secondary plan, like your different plans available at UCSD or for me, TRICARE, will pay second. And there's an exception here, and it's employer group plans that cover 20 or more employers if you still continue to work. This is called creditable coverage. We'll go over it a little bit more here in a couple slides. So what does this mean for you? Unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. And coverage must be based on current employment of yourself or your spouse. So what if you don't enroll in Medicare on time? Well, as I said in the beginning, you may pay late enrollment penalties. Those penalties are pretty substantial and they last for life. There's no way to remove them because what makes Medicare work is everybody being in the pot. So if somebody avoids being in the pot for 5 years, the way Medicare looks at it is if you are required to go on Medicare and you don't have creditable coverage and you don't sign up, they're going to charge you a penalty because you're not part of that pot of everyone in their paying in their premiums. Your healthcare expenses may not be covered by insurance, right? You may be restricted in different Medigap policies, potentially, dependent on when you sign up for them. And your private insurance options may also be limited. And that's more of the being denied for pre-existing condition, right? So I'll go over the specifics of that here as we get deeper in the presentation. So what is it? It's the National Health Insurance Program for people 65 and above, administered by the Centers for Medicare and Medicaid Services, right? Remember, Medicare is different from Medicaid. This presentation does not go over Medicaid, but they're different. Medicaid is for the impoverished. Medicare is for all of us. Enrollment through the Social Security Administration. Most of you will pay your Medicare premiums out of your Social Security paycheck. If you've come to my Social Security 101 or my advanced Social Security presentations, you probably are thinking about or considering delaying your Social Security benefit taking it until 70. And if you are, see you, Chris, with the thumbs up, good. Finally convinced you. And if you are delaying, then you do need to set up your Medicare Part B premiums with the Social Security Administration separate of your Social Security check, since you won't be receiving that. So just something to think about if you do delay your Social Security or claiming strategy. So who's eligible for Medicare? Well, everyone in the U.S. that's a U.S. citizen over age 65, including legal residents who've lived in the U.S. continuously for at least 5 years. And some people are eligible for Medicare under 65 all the way down to 55, depending on if they qualify for Social Security disability. So here's the nuts and bolts of Social Security, right? 4 parts of Medicare, or excuse me, not Social Security, Medicare. The 4 parts of Medicare are Part A, which is your hospitalization insurance, Part B, which is your medical insurance. If you see down here below, it says provided by Medicare, right? This is the public part of the partnership, meaning this is provided by the government. You still pay a premium here, Part B. And if you're not fully insured with Social Security, you'll pay a premium Part A as well, right? But this is the public part, and then this is the private part. So Part C, which is Medicare Advantage, just think of C as comprehensive. It includes all of these parts together, okay? It's usually going to consist of your prescription drug plan. It's going to usually consist of some type of what would be similar to a Medigap policy. But a Medicare Advantage, again, Part C, think of comprehensive, covers everything, right? And you have Part D, which is a PDP or a prescription drug plan. And then there's another part as well. If you can see this kind of lays out the same slide in a different view here. You got original Medicare over here on the left side, and then you have Medicare Advantage here on the right side. Medicare Advantage, you have A, B, and D all included in what's called Part C. Remember, comprehensive, right? They're like HMOs or PPOs. And typically include everything. And then you have traditional Medicare, which is Part A and B, right? Then you add on a prescription drug plan based on your specific needs. And this is where If you leave today with nothing else from this presentation, just realize that Medicare is something very personal to you and your health and your specific needs. And you need to do the research each and every year on what your plan covers, like these Medigap supplemental insurance plans or these comprehensive Medicare Part C plans change every year. Pricing changes, coverage changes. You need to be proactive and talk to your agent or whomever you are getting your policy through, or the people here at UCSD, and make sure on your behalf, knowing your existing medical conditions or maybe some family conditions that have been prevalent through the generations that you want to guard against. You need to be doing that research every year, making sure that your Medigap policy and your prescription drug plan are covering those to the best of the ability so that you're not having to come out of pocket for everything. Right? So again, the onus is on you to do the proper research for these different plans. Obviously, there's plenty of assistance out there. This is something I do not do, but I would highly recommend that you do find somebody that you can work with on helping you decide which is best for you. All right. So that's the two different forms of Medicare. So how do we enroll in it? Well, again, if you're receiving Social Security benefits when you turn 65, Parts A and B are automatic, and why is Part A automatic? Because if you're receiving Social Security, you qualify, you have 40 working quarters or 10 years of work history that qualifies you for free Part A. Part B automatically comes out of your Social Security check. So if you are taking Social Security, you turn 65, realize that your Social Security check is going to be less once you start Medicare because that premium is going to come with it. Remember that the coverage starts on the first of the month when you turn 65, and C and D are not automatic. That's the private partnership, right? You must choose a private insurer and proactively enroll. And that's what I said earlier, that again, the onus is on you to get out there and be proactive in researching the different options for you once you're 65 and above. Okay? You're not receiving Social Security when you turn 65, again, because you become, I've convinced you to delay your Social Security benefits for those higher delayed retirement credits and higher benefits down the road. And you must sign up to the Social Security Administration during a Medicare enrollment period. There are 3 different Medicare enrollment periods. The first is the initial, and that's if you're not covered by a group plan at age 65, if you don't have that creditable coverage. There's a special enrollment period, which is if you are covered by a group plan. Let's say you continue to work, you're 68, or maybe you leave UCSD, or maybe you have a partner that's a spouse or a partner that's in a private company like Sierra Pacific or something like that. They would be looking for the special enrollment period after age 65 if they've had creditable coverage. And then the general enrollment period, which is the penalty box if you've missed both of those different periods. And remember, if you don't get one of these 3 periods, you're going to be subject to a 10% penalty on your Part B and Part D premium for the rest of your life, and you don't want to do that. So when is the optimal time to sign up for Social Security and not receive the penalty? Well, so my birthday's in November 26th. So if, let's say I was turning 65, I'm turning 47, but if I was turning 65 this year, right, I would want to sign up either in October, September, or August. I could sign up as early as August. There's no reason not to do that, so that my coverage starts right here on the first day of the month I turn 65. So even though I don't turn 65 till November 26th, perceivably, my coverage would start on November 1st. Now, if you don't listen to me at all and you wait till the month, right, you totally forget about it, something like that, so you go in and sign up on November 2nd, I'm not going to receive coverage in November. My coverage is not going to start until December 1st, right? And then I have December, January, and if I don't sign up by February 28th or 29th, if it's a leap year, that's when I'm going to be subject to that lifelong 10% penalty. So when is the best time? Take your birth month, pick the month before, 2 months before, or 3 months before, but make sure you get on it there. You have no delay. You'll get first of the month coverage. The only exception to that is if your birthday is on the 1st of the month. If I was November 1st, I can actually start coverage on October 1st. So I want to make sure I signed up sometime in September or August. Right? That's only for those of you that were born on the first day of the month. Right? So who signs up for Part A during the initial enrollment period? Well, just about everyone that turns 65. Most of you at UCSD, if you're continuing to work, they're probably going to have you sign up for your Part A as well. So pick up coverage first, and then your UC plan, whether you're in a retirement plan or retiree plan or an active plan, right? That'll be the second coverage, right? Saves UCSD some money because Medicare is picking it up. So that's why it says here, you may be advised to enroll in Part A to enhance hospitalization coverage offered by an employer plan. So again, Medicare would pick up first, and then your employer plan. Excuse me, we'll pick up second. However, and this is a big however, don't sign up for Part A employer plan if you have a high deductible plan or an HSA type plan, because HSA contributions must stop upon enrollment in Medicare. Now, that does not mean you can't take the HSA that you do have, enroll it into an IRA, or take the HSA you do have, keep it in HSA, and pay deductibles or what have you. You can certainly do that from your HSA. So if you do have an HSA, or you do have the ability to continue to contribute to an HSA before you go on Medicare, please continue to contribute to that HSA, because when you are in retirement, you can use contributions in an HSA for one of two things: to roll into your IRA for retirement, or to use it on a pre-tax basis to pay deductibles or co-pays or these different things that you'll have when you're, right? So who signs up for Part B during the initial enrollment period? Well, people who are not covered, again, by that employer-sponsored group health plan that covers 20 or more employees. Also, people who are not working, turn 65, you're going to definitely, if you're not working, you're going to be signing up for that Part B. Self-employed, like myself, employed by a company with less than 20 employees, you don't have what's called creditable coverage. If you're on COBRA from a previous employer, you're receiving retired health benefits. That's like if you retired from UCSD at 63, you're receiving retiree health benefits. Betcha at 65, you are going to apply for both Part A and B, and you're probably going to switch over to one of the Medicare plans that UCSD offers. And employed by a company whose health plan is less comprehensive than Medicare, does not have creditable coverage, but could be more than 20 years. All right, so who signs up for Part D during the initial enrollment period? People sign up for A and B and want the prescription drug coverage. They're going that traditional Medicare route, meaning they're going to get A, B, D, and they are going to, and they're also going to get a Medigap plan to supplement, or Medicare supplement is also, right? Two options for Part D is, like I just mentioned, the traditional standalone plan, supplemented with a Medicare supplemental plan, or the Medicare Advantage. Remember, that's Part C, comprehensive, includes everything. All right. So the special enrollment periods for people who did not sign up in during initial enrollment period, Part B and D, most likely because they work for a private employer with creditable coverage. So then once they separate from service, right, they have an 8-month window, starting the month their group coverage ends, to sign up for Medicare. And then, of course, government in all of its wisdom made sure that Part D is not is not the same as Part B. They made sure that it was 63 days just to make it as confusing as possible. Government and all of our wisdom, right? So essentially, you got 2 months here and you have 8 months here. What is the best way to go about it? Right? Sign up right as soon as you know you're going to separate. If you're at a private employer, you're not a UCSD person on here, and you're listening because you have access to this stuff, you want to make sure you sign up with your HR group prior to separating from your current employer. Okay. To avoid later enrollment penalties, sign up during initial special enrollment period to avoid gaps in coverage. Sign up before current coverage ends. Then there's the general enrollment period, which I call the penalty box. If you missed it all, you were asleep at the wheel, and you sign up during these 3 months, January, February, March, and your coverage starts July 1st. Well, that's a problem, because you can see from March to July 1st, or from January to July 1st, whenever you sign up, you will not have coverage, right? So don't put yourself in the penalty box. Just a quick review here. Initial enrollment period is what most of you will go through, right? Best time to sign up, 3 months prior to your 65th birthday, and coverage starts on the first of the month you turn 65. Special enrollment periods for everyone over 65 who's covered by a plan. You have that 8 months and 63 days that don't make any sense. Best time to sign up before the coverage ends. And then the general enrollment period, which is the penalty box, which no one wants. So where do you do it? You go right here, ssa.gov. You push the button, Medicare benefits. You can always call somebody if you want. Probably wait a couple hours to talk to someone. So best to just go push the button there, apply for Medicare benefits. So how do you sign up for Medicare Part D? Well, first of all, you decide which path you want to go down. I'm going to go traditional and look for a Medicare supplement plan, or Medicare, or what's commonly called a Medigap plan. Or am I going to go Part C, which is that comprehensive, which is much more like an HMO, or like a Kaiser type of plan where everything is done in-house. That's a decision for you to make based on your health and what you're looking for. One quick thing I will let you know when it comes to Medicare Advantage plans and Medicare supplement plans. Right, if you go traditional Medicare, you cannot be denied for pre-existing conditions only one time, and that's upon your initial or special enrollment period. Okay, after that, subsequently after that, you can be denied for pre-existing conditions. but they can't remove you out of your plan. So if you are somebody with pretty comprehensive, health issues or, health past or potentially something that's hereditary or something in your family, I would highly encourage you to look at a Medigap or Medicare supplement plan that is comprehensive for you to get in it on your initial enrollment period or your special enrollment period so that you will not deny it for pre-existing conditions at a subsequent time. On the other hand, a Medicare Advantage plan, again, Part C, comprehensive, can never deny anyone for pre-existing conditions. So there's always going to be an option out there for you. But if you really want that supplement plan, that traditional Medicare, which tends to be a little bit more comprehensive, then even though I say C is comprehensive, but tend to be a little bit more, the better word's probably niche on the Medicare supplement plans. They really go after certain types of health ailments that people suffer from. And so do your research and make sure you are not skipping on a Medicare Advantage, or excuse me, Medicare supplement or Medigap policy on your initial enrollment, because potentially you could not come back to it down the road when you really need it. Okay? So premiums, nearly half of beneficiaries out-of-pocket health spending, right? So the average out-of-pocket spending on services and premiums among traditional Medicare beneficiaries is back in 2016. These numbers are obviously higher. You see premiums here are almost half of the pie, and services are just slightly over half. All right, so out-of-pocket costs paid by Medicare beneficiaries. So this is what gets a little confusing. There's a lot of costs that you're going to pay for that you don't realize. Everyone knows, okay, I got to pay my Part B and my Part D premium potentially, but there's some other things that you're going to pay for that you may or may not know. So Part B premiums are paid to Medicare, and the private insurance premiums that you're going to pay for a Medicare Advantage plan, or like I said, that Medigap policy paired up with a prescription drug plan of PDP. So that's premiums that you're going to pay for. What are the other costs you may not be thinking of? Well, there's deductibles, right? Portion of the doctor bill not paid by Medicare. Again, when this is on you to do the research, am I going to a doctor that keeps their prices in the Medicare window or not? Am I going to be paying out of pocket for the portion not covered? And then services not covered by Medicare. So let's look at the premiums. As I said earlier, it's about 40%, 40 to 45% overall out of pocket costs. If you qualify for Social Security, meaning you have 40 quarters or 10 years, it is zero for you. If not, you're 30 to 39 quarters, less than 30, you could see it's pretty substantial. I mean, you're looking at 6,000 a year if you have less than 30 quarters. If you are working right now and you almost qualify for Social Security, you may want to consider working a little bit longer so that you get your full Social Security benefit, save yourself $3,500, $4,000 a year, and just Part A premiums plus get your Social Security benefit. Right? That's really helpful. The Part B paid to Medicare went down a little bit from 2022. 164 a month in 2023. And here's the big, as we used to say in the Navy, a foot stomper, or put a big asterisk next to this, plus your income related adjustment if applicable. What is that? It's commonly known as the IRMA. You can see down here, Part D, paid to the private insurer, also varies with the plan, and plus the income related adjustment paid to Medicare. This is how Medicare is means tested. Okay? Means test this based on your income from 2 years prior. This is the IRMA for Part B. Income related monthly adjustment amount is based on your income from 2 years prior. So for 2023, they're taking your 2021 tax return, and then they're either putting you in beneficiaries, you file your individual tax return. They do this thing called modified adjusted gross income. Beneficiaries who file joint tax return. And if it's, again, let's say you have a tax return that shows 194,600, right? Income related monthly adjustment is going to be $65.90 a month for a total of $23.80. And now you can potentially multiply that times 2 because you're obviously filing a joint tax return, right? Here's where it gets ugly. Look, 366 to 750. Now you're looking at 362.60 of your income related monthly adjustment, plus your 160 in Part B premium. And you're looking at 527 versus 164.90, and that's for each of you for 12 months, right? So some of you out there may say, "Well, I don't make that much money." Well, how do you accidentally get? And here's the same for the Part D plan, right? These numbers are all you have to do is type in Medicare IRMA IRMAA, and they will pop up. So if you're interested in knowing what these numbers are in these brackets, right? Just know that you get it for both your Part B and your Part D, and it's based on modified adjusted gross income. Well, here's the problem. You say, well, I'm never going to make more than $750,000. But But most of you own a home here in Southern California and San Diego, right? And it's probably highly appreciated from the time you bought it. Now, if you're married, you get the $500,000 exclusion if you've lived in it for 2 years. But let's say you bought that home in Claremont or in the La Jolla area for $500,000 back in 1994, 95, and you're going to retire to Arizona and you're going to go sell that home. You're going to sell it for $2 million now, not $500,000. We got a $1.5 million capital gain. You get a $500,000 exclusion, and the rest of that $1 million is a long-term capital gain, right? Okay, great. It's a long-term capital gain at the federal level. Does California recognize long-term capital gains? Nope. Ordinary income in California. And on top of that, you're going to be in this modified adjusted gross income bracket over $750,000. And therefore, you are going to pay this very big premium for the entire year. You and your spouse are going to be paying it. So be aware of that. How does Social Security, that is tax 85, fall into the Medicare IRMA? You said total adjusted gross income. Could you explain a bit more? Yeah, Chris, that's a great question. So it's actually modified. So you can see up here the word says modified adjusted gross income, which modified adjusted gross income is just adjusted gross income plus 1/2 of your Social Security benefit. That's where that comes in, plus tax-free interest. So you can't hide out in municipal bonds. The only real hiding place is in a Roth IRA or in a deferred annuity if you don't want to have higher income. But good question, Chris. Thanks for sending that over. All right, so that's the IRMA. This is an older slide, so this goes back to 2020, but this just kind of shows you how the difference in premiums are for these higher income ranges, right? So it's still, this range hasn't changed over 750,000. You can see, and this is pretty substantial when you put the B and D together. And it's actually closer to 700 now. So 700 times 12, we're looking at 860, or excuse me, 8,600. Now times 2, that would be 17,200 just in Medicare premiums per year. That's pretty substantial. That's not anything to do with deductibles or co-insurance or co-pays or any other stuff, right? So speaking of deductibles, let's talk about that. So 2023 deductibles. This is the amount you pay. Part A, $1,600 per spell of illness, right? Going to the hospital and have something wrong, that's $1,600. You leave 2 days later, they're fine. You get sick again, they're going to call a new spate of illness, and you have $1,600 more. Now, this doesn't necessarily mean you're going to be paying all this out of pocket. This is why you get a Medicare Advantage plan or a Medigap plan to help with some of these things, right? And that's why, again, the onus is on you to do the proper research to know what you're going to pay for and what you don't have. All right. Part B, $226 a year, in which waived for some preventative services such as flu shots, some mammograms and pap smears, bone mass, prostate, yada, yada, yada. And Part D is now $505 a year. All right, so here's your co-insurance. So these were deductibles. We talked about premiums back here, right? Now we're talking about deductibles. And now let's talk about co-insurance. Again, this is that litany of things that you may or may not have thought about when you're signing up for Medicare. So co-insurance amount you're going to pay for Part A, hospitalization insurance, $400 a day for days 61 through 90, $800 a day, 91 through 150, and skilled nursing is $200 a day for 21 through 100. Well, what happens after 100? You're getting sent home, and then it's, again, it's going to be on you if you need skilled nursing care of some kind down the road. That's why, of course, you look into long-term care insurance. Your Part B, co-insurance, assigned claims, 20% of the Medicare approved rate, unassigned claims, 20% of the approved rate, plus the balance of the actual charge up to an additional 15% of the approved charge. Realize that these co-insurance, this is what you need to do that research on the private side of insurance for, to make sure it's helping you cover some of these things, right? Part B, D as in Delta, co-insurance in 2023, right? It's $505 deductible, then 25% of drug costs after deductible has been paid, and a small co-payment once your out-of-pocket spending has reached $7,400. So this is the catastrophic level, and you have a very, very small co-payment after that. So $7,400 is going to be the max. Just remember, they vary. Drug plans do vary very widely, and some will pay more, some less. And it's important to find a plan that covers the drugs you in caps take. Right? So what Medicare covers: hospitalization, 100% of the first 60 days, medical services, so your outpatient services, doctor visits, 80% of the Medicare approved amount, some preventative stuff. We'll discuss that as well. You can go to Medicare and You for a complete list of covered services. That's just, you can find that on the SSA site, or you can just type in Medicare and You, find that. What does it not cover? Right? So long-term care, I think pretty much everyone knows that. The second one is interesting. My mother's from Mexico City, and she always had told me that if she needed care and It's costing her too much to live in the United States. She was just going to go live in Mexico and she was going to get care there. And I always tell my mother, it's great in theory, Mom, but you're not going to get any care whatsoever. You get your Social Security benefit if you live in Mexico, but you're not going to get care outside of the United States. So be aware of that. Right? If you want to go live in Belize or Mexico or wherever you want to go. Dental care, vision care, hearing aids, cosmetic surgery, pretty obvious there. Amounts not covered by deductibles and co-insurance, and amount over the Medicare approved amount. These are all things that if you're going to have, I mean, not going to stop going to the dentist because you retire. Probably going to need more vision stuff. I just started wearing glasses myself. Great. I feel like I've graduated to the big leagues. After not having to wear glasses for 45 years, it's like I turned 45 and reading glasses the next day. So it kind of coincides with the gray hair and young children. Anyways, just be aware that you're going to have to pay all this stuff either out of pocket or you make sure that you get your Medicare Advantage plan that you pick that covers it, or maybe you get a Medigap policy, right? A Medicare supplement that covers some portion or maybe all of this, just depending on what you get. Right? So what private insurance may cover in full or part? The deductibles, right? The Part A deductible, hospital costs, 20% that Medicare doesn't pay, amount the doctor charges over potentially, prescription drugs, the deductible, yeah, not a lot of plans do that, but most of the cost of certain drugs during the initial benefit period and the catastrophic coverage, right? Medigap policies, this is that traditional Medicare, private health insurance companies, right? Cigna, Blue Cross Blue Shield, all that stuff that you're familiar with for individuals, sold by private insurance companies, and it's the supplement to original Medicare, so parts A and B, again, to your hospitalization insurance and your outpatient services, doctor visits. They have to follow certain federal state laws that protect you, right? So the Medigap insurance companies can only sell standardized Medigap policies. They're usually identified in most states by letters, right? They don't work with Medicare Advantage. Remember, that's separate. You pay the monthly premium cost for by plan, company, and location. And remember, the only time you cannot be prevented from purchasing one is during your initial or special enrollment period. After that, they can limit people to the plan because of pre-existing conditions. So just be aware of that. Okay, most common Medigap plan is F, right? That's pretty much 99% of people take F, but this is just an example of all the different stuff. Not too important. If you want to review that side, you can go back to the YouTube. Medicare Advantage plans, much more like a Kaiser, right? It's a health plan option approved by Medicare. Remember Part C, remember C, comprehensive. Run by a private company, Medicare pays amounts for each member's care. And you may have to use, just like a Kaiser thing, you may have to use the network doctors or hospitals and go outside of the networks. If you're someone who's going to live in a pretty remote place or potentially do a lot of traveling in retirement, you may want to really scrutinize these Medicare Advantage plans, make sure that you can use them outside of maybe just the San Diego network. Stacy has a question. Just to confirm, you would never have a Medigap or supplement you are in a Medicare Advantage, but that's correct, Stacy. Good question. Traditional Medicare is Part A, B, prescription drug plan, which is D, and a Medicare supplement plan, or also known as Medigap. Medicare Advantage, which is what we're discussing right now, is the comprehensive. It is totally separate. So you would never have an Advantage plan with a supplement or a Medigap. Okay. Back to Medicare Advantage, may have to use network doctors, include prescription drug coverage. Most of the time I see people taking Medicare Advantage plans because they include these extra benefits like vision, dental, maybe cost of going to the gym, stuff like that. Just again, the onus is on you. You have to do the research for yourself. Absolutely, Stacey. Thank you for the question. So if nothing else you leave from here, just remember you need to shop carefully for your private insurance. Medigap policies are standardized, but the premiums vary very considerably based on demographic and based on where you live in the country. It's crazy that works that way, but that's just the reality of it. Choose the policy that offers the coverage you need, right? Choose a reputable company offering that policy at the lowest price. This is where it helps to consult with either a professional that sells Medigap or Medicare supplement plans, right? Choose carefully. I will warn you there too. There are, just like my industry, there are a lot of people there that are looking to make a quick buck, and then there are wonderful people in the industry that'll be very helpful. So make sure you do your proper research. Maybe get a referral from someone you know that's already gone through it. Make sure your healthcare provider processes the billing for the company you choose. Remember, drug plans vary considerably as well, and choose the plan offering the coverage you need for medicines that you take, right? And the Medicare Advantage plans also vary considerably, and there is no pre-existing condition limitations within Medicare Advantage. So you can always switch to one of those if you want to. So final part here, part three, planning for higher healthcare costs in retirement. Right. See here, I mean, it doesn't, and this goes back to, I think, to 2016, right? The Kaiser Family Foundation analysis, Centers for Medicare and Medicaid Services. I think the biggest takeaway here is, you're 65, 74, within, from 74 in close to 10 years, you can expect your medical, your services, and you can see here 22 award to 7309, services go skyrocketing, right? As I showed you that graph earlier, when you start Medicare, premiums account for about 42 to 45%, depending of your overall cost. What happens is services rapidly expand because you just need more care. Okay, so just be prepared to that budget. That here's a typical Medicare budget. This is a 2020 number. I didn't adjust it to 2023, but you got your Medicare Part B premium, you got a Medigap premium, you got the prescription drug plan. So this will be traditional Medicare. Now you got to multiply that times 12. So now you're here. Out-of-pocket costs, dental, vision, alternative care, 6215, and that has no income-related monthly adjustment whatsoever, right? So it's pretty easy to see if you're a couple, you could be spending 12 to 15,000 or even higher just in your insurance premium and out-of-pocket costs. Okay. So what can cause the budget to change in the future? Rising healthcare costs. I think we're all well aware of that, and a change in health status, right? You may have something that's not covered that you need to switch for, and then again, the big one is down here, long-term care. So according to Fidelity in the Employee Benefit Research Institute, this is how much you're going to need roughly, let's just call it 300,000 for couples, right? That you're going to need in your retirement. And you say, well, hey, great, that's great. I have an IRA, it's got 300,000 in it to cover it. Well, remember, take money out of your 403B, 457 or IRA, you got to pay ordinary income tax first, and then you can pay for your care, right? So be well aware that it's really not 300,000. If you're taking it out of your retirement accounts, it's probably more like $500,000. Okay, so be aware of this cost and be aware that it's out there and plan for it. Use your financial planner or whoever you use to map this out for you in the form of a financial plan and map out, some supplemental costs based on your different assets and what you can do to, potentially stave off any risk of running out. Right? Planning for long-term care, again, like I said, I'm just going to touch on this briefly. Because I know you have an expert that comes in and speaks on this, but long-term care is not covered by Medicare or Medigap, right? Remember, it's only the first 100 days Medicare and hospitalization for skilled nursing, and after 100 days, you're sent home. No coverage whatsoever with activities of daily living. So 35% of people over 65 have activity limitation. That's a pretty large number. I mean, roughly 1/3 of people in this country over age 65 have activity limitations. So what are the causes of the limitation? Right? So heart disease, hypertension, arthritis. Anyone know what the number one cause of long-term care event is? Anyone want to venture a guess? Yeah, it's a fall, right? It's a fall and a broken hip usually is the number one cause of a long-term care event, right? And, the research is a little fuzzy on it. Was the fall caused by the broken hip or it was just a fall? So we don't know because we know osteoporosis and obviously, brittle bones as you age becomes an issue. And I'm not trying to depress anyone here. Remember, Suzanne used to always say this is the most depressing presentation. I think it's just important that you be aware of this stuff and that, you plan accordingly, specifically have a conversation with your family, maybe more so than just your spouse, maybe children, if you have them, adult grown children like myself. I've had these conversations with my mom and my father about, what their plans are. This is a little bit of an older graph here, but what this tells you is, 65 to 74, very few people have issues with bathing, showering, dressing, eating, getting in and out of bed, which is also called transferring, walking, using the toilet, right? But you can see how it goes exponential by the time you get to 85, right? Particularly walking, right? Particularly based on, starting here, bathing, showering. Just be aware of this. This is what you do long-term care planning for. Some of you will have enough means to self-insure, and that's fine, right? And some of you may need to grab a policy, a reason like that. So I'm going to skip some of the rest of this and get to the 3 reminders here. Random on, just make sure you enroll in Medicare on time so you don't have to pay that penalty. I think I've said this enough times. I'll say it one more time. Shop carefully for private insurance to go with Medicare, right? You get that first chance on your initial and of course special enrollment period. to sign up for a Medigap or Medicare Advantage plan, actually Medigap or a Medicare supplement. Make sure you're signing up for the right one. Do the research. Medicare Advantage, if you go that route, you can always switch those. There's no pre-existing conditions for Medicare Advantage. Just do some careful shopping there. And reminder number 3, this is pretty obvious, higher healthcare costs in retirement, certainly. And with that, I will open up the floor for questions, if there are any. If you have any questions regarding this presentation, I'm going to put my email address.
Yeah, I have a quick question.
Please.
Thanks for the presentation, but where would I go to you said there are various different Part C options, right?
Yes.
So where go to compare those and get all the information? Would that be the
Yeah, that's a good question.
SSA website?
No, well, are you part of the UCSD program?
Yeah.
Yeah, so on Wednesday, what is that, Ronnie, you said Wednesday they're coming in?
Yes, on Wednesday.
Yeah, so on Wednesday, you'd want to ask them and reach out to your HR reps within UCSD. They can walk you through the different Medicare plans.
Okay.
All right. When traveling outside the country, could you explain the benefits through Medicare? Thanks, Ryan. Yeah, so there are none. That's the easiest way to explain them. Yeah, like I said, you still get your Social Security benefit. I know a lot of people take out, especially if they're older and they're traveling internationally, take out like you can buy like a supplemental insurance policy, international policy or something like that. Covers you in case of something catastrophic. I have a client that, fairly wealthy client in Colorado that took a cycling trip in retirement to Switzerland, fell off his bike, broke a bunch of bones. And fortunately, he did buy one of those policies, and the policy actually had a provision to fly him back on a private jet from Europe if it was catastrophic enough that he needed significant care, and he did. Fortunately, he recovered, and fortunately, he was able to be flown back in that insurance policy. So if you're going to travel internationally, I would do the research on that. Make sure you have something that covers your enemies.
I think Gail might have had a question. Gail?
Is the SSA site pretty straightforward?
Yeah, I just put it in the chat.
Yeah, I have you ever seen a government site that's really, really straightforward? I haven't, so maybe you have. I'm without trying to be facetious here. I think I find the SSA.gov site fairly good. I think you can do just as well just by Googling things. Make sure you know where your sources are. I mean, today, this presentation, I just Googled the updated numbers on the premiums and the deductibles and all that. And it matches.
So to first log on to SSA.gov. From there, are there text boxes and things like that to walk you through the path of the initial enrollment and yada yada yada?
Yeah, Gail, are you part of the UCSD system? Because
I am.
Okay, perfect. So you have representatives right there.
For Wednesday.
Yeah, well, not just Wednesday, but you can reach out to them at any point, set up an appointment, and they will walk you through enrollment and walk you through the different plans that are available within the UC system.
Is that on UC Raised?
Vanya, do you know? Does anyone out there know? I'm not quite sure because I'm not part of the UC system. I just know that it's available to you.
Okay.
I believe so. Gail, if you want to send me that and I'll do some research into it, I can do that.
All right. Thank you.
Another quick question.
Yeah, sorry, I'm going to answer Julie's here in the chat. If my retired husband's on UC's Medicare Advantage plan, can I? Yeah, Julie, absolutely. You do not need to be on the same plan as your husband. That's, again, personal decision there, but that's a good question as well. And then I'll answer Stacy and then whoever else was chiming in. Kaiser Advanced Plan Senate form has extensive language about releasing legal rights except for arbitration. Is this normal? Should I word as a standard for? I'm not an attorney, Stacy, but every plan I've ever signed up for, yes, has had a lot of that same verbiage language. That's a great question for Wednesday, though, because they'll know more specifics on the Kaiser plan. And then I believe Alec raised his hand here. Go ahead, Alec.
Yeah, I was just wondering, do any of the Medicare Advantage programs give coverage for living abroad?
It's going to be specific to the Medicare Advantage plans. great question. I would have to do the research on it. I have not seen one, but maybe you can notify me if you do find it.
Thank you.
Absolutely. Well, without any more questions, we, by the way, the online SSA sign up was super easy. Great, Stacy, thank you for sharing. Yeah, I think her question was more around, navigating around different plans and stuff like that. But that's definitely what you want to engage the folks at UCSD for. They're great. You've got a great HR department. So
Would
being-
that include the Medicare.gov site as well?
Yes. Yes. Do I consult privately on Medicare? No, actually, Julie, I don't. I apologize. Again, you have the HR reps. I'm a financial guy. We do give different advice to our clients on Medicare stuff, but I don't sell any Medicare policies. This presentation is one that was asked for me to give by Suzanne about a decade ago, and it's just to give everyone a background on the basics of Medicare. And it is being reported. You're more than welcome to go review it as much as possible, or you can send me, if you have a specific question, feel free to send me an email. I'll write my email.
I have one more, but
Yeah, please go ahead.
so I'm retiring in July. Can I go sign up now, or do I need to make my decision first about whether it's going to be, Medicare Advantage or Medigap first?
Yeah, you can go sign up now, or at least do the research. Well, let's see, March, you said July. Yeah, so June, May, April, I can start, sign up next month. And yeah, I think it's great that you're doing the research now, Alec. I would go out there and talk to I'd set an appointment with the HR group that's going to speak on Wednesday. Have them walk you through the different plans, what the coverage are, and then figure out which one's the best one for you and your specific needs.
Thank you.
Absolutely. Congrats on the retirement. I feel like I'm only about 160 years away. If you have a high value property that you're going to sell and then would be pushed into higher cost Medicare, can you sell your home over a period of years to the buyer to lower your capital gains? Julie, I like that. I like the way you think, but no, I don't think. First of all, I don't know if you're going to find a buyer that's going to say, "I'll buy 1/3 this year from you, 1/3 next year, and 1/3." That would be an installment payment, and you would be taxed. There would be, my guess is, there would be what's called imputed income. I'm not a CPA, but I'm pretty familiar with taxes. You'd have what's called imputed income. There are methods to sell a home that way. Really, I'm not aware of them. If it's not your primary residence, something you could also do is look at a 1031 exchange and completely defer the taxes. If you did that, there's some rules around that aren't part of this lecture, but I like where your head's at. All right, everyone. I think that's about it. It's 12:50. I'm going to go have my lunch now. Wish everyone a great Monday. Have a great week. And we'll see you here tomorrow if you're interested in Silicon Valley Bank. If not, hope to see you next month.
Glad you're feeling better.
Yeah, thank you. Sorry about last Monday. My daughter's
Yeah.
good.
Glad,
news.
thank you,
All right, thank you,
Ryan.
everyone. Bye now.
Thank you.